Hey, welcome to Whiteboard Wednesdays. It's Dr. Michael Lepore with Sarasota Vascular Specialists. Today we're going to talk a little bit about wound healing and how the circulation, both venous and arterial circulation, can have an effect, as well as some of the signs and symptoms and the ways that we figure out where the problem is. We basically recognize that the wound's not healing, it's taking longer than typical. Most of the time, this is going to be on the legs, although some people can have diminished circulation in the upper extremities. We probably see it a little bit more in the legs. Typically, you have a cut or a scrape or an avulsion or an injury or something that's happened in the past that you've gotten, and it heals well when your circulation was normal. If it's taking longer than typical, or the wound instead starts turning dark, discoloration in the lower extremities, in the toes, between the toes, ulceration that occurs, then there's a problem. As we talk about here, is it my arteries, the signs and symptoms? Before you get to a point that you're having wound healing problems, those patients are going to have problems with ambulation, meaning they're going to have problems walking any specific distance or beyond a specific distance before they get to the point that they can really no longer walk very far at all, or they start having pain at rest, which is a limb that's actually at risk. Those patients may have circulation that's much more challenged the further down you go, down the lower extremities towards the feet and towards the toes, certainly where that can become an issue. And patients that are going to be affected are patients that already have known vascular disease, patients that potentially have diabetes or some other underlying high cholesterol issue, as well as patients that maybe have a family history of having that or strong tobacco use history. Those are the patients that are really going to be at risk from the arterial standpoint. And then venous insufficiency is another issue, and that can be recognized in advance, and the signs typically are going to be patients will have problems with the veins draining the blood back up to the heart. So when that happens, usually we'll see those patients have a lot of swelling with their lower extremities. So there's going to be some precursor to that the patients know they have an issue with their venous circulation, and maybe discoloration in the legs, darkening discoloration of the legs, maybe bluish discoloration in the legs. It can really show itself in a lot of different ways. You could have one leg that's more swollen than the other, and that's really the subject of another topic when we're talking specifically about veins. But that back pressure in the legs can really challenge the wounds from healing or cause the wounds to weep and drain, and that causes some issues as well. So the signs and symptoms of those, typically patients are going to know in advance because of that. They've had swollen legs, or maybe their legs are actually weeping fluid. That can be another issue that occurs. So how do we image these? We typically will start with the easiest imaging modality, which is going to be an ultrasound. That's the least invasive, using sound waves to basically look at the veins and arteries. In those imaging modalities, we can identify on the arterial side a blockage that's basically stopping the flow from getting down to the lower extremities and allowing the lower extremities to get enough circulation to be able to heal properly. Or on the venous side, the veins are trying to get the flow back up. Valves aren't functioning properly, or maybe there's a blockage from prior blood clots that are causing some issues in the lower extremities, and that back pressure can cause healing issues as well. CTA and MRI are the next level of modality of imaging. They're a little more invasive. CTA is a CT angiogram, requires an IV and some imaging in some way to look at basically all the arteries, which you can look at in the upper extremities and the neck up to the brain, as well as lower extremities and down all the way down to the toes, that we can see that. The smaller arteries are not as well visualized on CT angiography. MRI or MRA, really, which is MR angiography, is another way to look at the arteries. We don't really use that as much because it has a tendency to overestimate blockages, and CT angiography would be the next step. And then the gold standard that really shows us the best imaging, but is the more invasive, would be angiography. And we typically don't go to angiography until we think we're going to perform treatment, some type of balloon angioplasty stent, opening of an artery or something like that, or opening of a vein or something like that, as well as ultrasound that we may use in the artery to really understand what's going on with the blockages and try to improve the flow. So in summary, we're talking again about wound healing and circulation. How do the arteries affect that? How do I recognize those problems? And again, you're going to know that before you ever get to the point that it's so severe that you're having wound healing problems from a walking or a swelling problems, whether it's arterial or venous respectively. And then what are the things I need to do to think about treating it? First, we have to image those things, and we use ultrasound, CTA, MRA, or possibly angiography, which is the more invasive way, but that still minimally invasive way of ultimately treating these problems. Again, this is Dr. Michael Lepore on Whiteboard Wednesdays with Sarasota Vascular Specialists talking about wound healing and circulation.